So now video 2, we're going to be talking about the nerve plexus, and first we will be talking about cervical and all the nerve branches that are in the cervical plexus. And first we have lesser occipital, and it provides nerves to the external part of our ear, the mastoid region, the parotid salivary gland. So that's lesser occipital, and then we have greater auricular, which provides nerves to the anterior and lateral neck under our chin. Next we have the ansa cervicalis, and it provides nerves to the omihyoid, sternohyoid, and sternothyroid. And we also have the transverse cervical, which provides nerves to the anterior and lateral neck underside of our chin. For the last two, we have the supraclavicle, which is the supplying nerves to the lower anterior and the lateral neck and anterior chest. And one of the most important nerves in the cervical plexus is the phrenic, because it provides nerves to our diaphragm, pleura, and pericardium, and that is one of the most important ones. So that concludes the cervical plexus, and then now we'll talk about the brachial plexus. The brachial plexus, and first up we have the musculocutaneous, which is a big word, and it provides nerves to the skin of the forearm, the brachialis, the biceps, the coracobrachialis, yes. And then next we have auxiliary, which is the skin of the shoulders, arm, deltoid, teres minor underneath, and that's auxiliary. We also have radial, which is the skin of the posterior arm, forearm, the carpals, mainly the posterior hand, most extensor muscles of the arm, and we also have the median, which is skin of hand tips, digits, mainly forearm flexors, the thenar group here, and I think I'm missing one, which is the ulna, and it also provides some nerves to some of the forearm flexors, as well as the digits or lumbricals. And yes, that concludes the brachialis plexus. We are on the lumbar, and first we have the iliohypogastric, which is the upper abdomen area, provides nerves to the upper abdomen area, the gluteal, internal and external obliques. We also have the ilioinguinal, ilioinguinal, and skin of most of the upper and medial thigh area, the roof of the penis, as well as the female labia. Next we have the genitofemoral, which is the skin of the middle of the thigh, the male scrotum, and the female labia. Next we have the lateral femoral cutaneous, and that is also some skin of the upper thigh, but no motor. We also have the femoral, which is the skin of the lateral thigh, the knee, the foot, the pectineus, the quadriceps, the sartorius. We also have the obturator, which is the skin of the thigh, knee joints, the abductors of the thigh muscles, and yes, that concludes the 5. And for the sacral plexus, we have the superior gluteal, which provides nerves to the hip joint, gluteus minimus, gluteus maximus, on the side of our leg, which is the tensor fascia latae, that is superior gluteal. We also have inferior gluteal, which is the gluteal maximus, and that's the bigger part of our gluteal. Also the tibial nerve is next, which provides nerves to the skin of our posterior leg, our knee joints, our hamstring muscles, most intrinsic foot muscles, and that's tibial. We also have fibular, which is in our lower extremities, and it provides nerves to the skin of some of the foot, the bicep femoris, the extensor digitorum, the extensor digitorum brevis of the foot. Also, lastly, we have the pudendal, which is provides nerve to the skin of the penis, the skin of the clitoris, the majora, the minora, the lower vagina, and it provides motor nerves to the muscles of the perineum. I also forgot to mention, Professor Curio, in the beginning of the video, that with all the nerve plexus where they are located on our body. So I'll just start from the beginning again. For the cervical, it will be located in this area in our neck, being able to move our neck. So they pretty much run between our head and neck area. They don't go too much lower than the beginning part of our neck here. And then next we have the brachial plexus, which supplies nerves to all of our arms, forearms, our extensors, everywhere on our arms. It provides nerves also to our digits or our metacarpals. Also next would be the lumbar, and the lumbar provides nerves to all of our front muscles. Yes, all of our front thigh muscles. And then, well, our abdomen and front muscles, and then our sacrum provides the nerves to our posterior lower extremities. So from our gluteus maximus and minimus down to our feet. So that concludes all of the nerve plexus, and then now we'll talk about the cranium. So next we have the brain. Yes, the brain plexus. And first we have the nerves that are in the brain. Are the olfactory nerve, which provides which function is smell. We have the optic nerve, which is obviously vision. We have the oculomotor nerve, which is eye movements. The trochlear nerve, which is also eye movements. We also have the trigeminal nerve, if I'm pronouncing it right. We also have the ophthalmic division, which is touch, temperature, sensory, obviously, pain in the upper face. That hits home for me. That's the part of the brain my mother had her stroke in, the thalamus. And that was like a lot of the stuff that she experienced was loss of touch, not knowing being hot or cold. But anyways, next we have the maxillary division, which is the same as the thalamic touch, temperature, sensation in the upper face. Then we have the mandibular division, which is also the same as the two I just described. We also have the abducens nerve, which is eye movement, more like lateral eye movement, so out. We also have the facial nerve, which obviously controls facial expressions, tears from our lacrymal, saliva, nasal mucus, and